Smith. My name's Yan. I'm going to be your nurse today. Before we get started, I'm going to clean my hands for 20 seconds. How's your day been? Good? I'm here to change the dressing on the central venous access device, which is the tube that is going to your chest. Have you ever had this done before? Yes? Okay. I'm still going to explain the procedure to you again because every nurse does do it differently, and I want you to know what to expect. Okay? Let's begin by giving me your full name, date of birth, Claudia Smith, October 13, 1969. It matches the wristband. I don't see an allergy band, but do you have any allergies to chlorhexidine, latex, or tape since they're part of the supplies that I'll be using today? No? Okay. Do you have any pain right now, especially around the site where the dressing is? No? Okay. Before we do anything else, I'm going to wipe down this table for 30 seconds and put my stuff down. 30 seconds of hand hygiene. Gloves. Alright. So, Mrs. Smith, did you have a good morning today? You did because you like the eggs? That's nice, Mrs. Smith. Other than the eggs, did you have anything else for breakfast, Mrs. Smith? You also had bacon, but you didn't like it very much. Is there a particular reason why? It wasn't crispy enough? I can understand that, Mrs. Smith. Alright. 20 seconds of hand hygiene. Alright, while this table dries for 2 minutes, I'm going to explain the procedure I'll be performing today. The procedure is called a CVAD dressing change. CVAD stands for Central Venous Access Device. This is the catheter running from the large vein near your collarbone into your heart. This allows us to administer medication, fluids, or nutrition directly into your body. Today, I will be removing the old dressing and replacing it with a new one. Per hospital policy, CVAD dressings needs to be changed every 7 days or sooner if it gets soiled or lifted. This is a sterile procedure. We both need to wear a mask to reduce the risk of infection. I'll also then have you turn your head to the left side because the dressing is on the right side of your chest. We are doing this to prevent breathing onto the site or any expellents from coughs or sneezes from contaminating the site. Once we have masked, I'll take off the old dressing. You might feel pulling or tugging, but it should not hurt. After that, I'll assess the site for redness, swelling, or signs of infection, and to ensure the tubes are intact. Then I will clean the site with chlorhexidine, which might feel cold, and we will let it dry. After, I will put on a new dressing, and then we will secure the tube with tape. Once it's done, the procedure will be finished. Okay, do you have any questions, comments, or concerns regarding the procedure for me, Mrs. Smith? No? Okay. Do you have any problems turning your head or maintaining it in the position, the left position? No? Okay. Now that the table is dry, I'm going to put my supplies down. 20 seconds of hand hygiene. I have a BioPatch, Sorbiview, and a CVAD dressing change kit. This is the mask you'll be wearing throughout the procedure. I will help you put it on. Alright, please turn your head to the left, Mrs. Smith. Thank you so much. 20 seconds of hand hygiene. All right. All right. 20 seconds of hand hygiene. I'm going to pull down your cover and gown just enough to see and assess the site, but I want to assure maximum amount of privacy as much as possible. All right. 20 seconds of hand hygiene. I have donned clean gloves to remove the current dressing, Mrs. Smith, and I will do that now. All right. 20 seconds of hand hygiene. All right. The site looks clean. There is no redness, swelling, or drainage. The marking here is 20 centimeter and matches the one noted in the chart. The tubing is not cracked or leaking. All right, I'm going to put on sterile gloves and start the sterile part of the procedure. All right, I'm going to crack this chlorhexidine scrub and scrub 2 inches around the side in the tube for 30 seconds. Are you in any pain, Mrs. Smith? No, that's good. Oh, you want to know what's for lunch today? I believe it will be chicken and rice, but I will have to check with the kitchen after this procedure. All right, I will let this dry for 30 seconds. Oh, you want to know we'll have egg again tomorrow morning? I believe I will be able to check that for you. Do you usually like eating eggs, Mrs. Smith? That's nice. Right. I will apply a bio patch now onto the tube. The dressing is on. I will label the dressing with the gauge, date, time, and initial. The squab hub cap is on, tight, and secure. How did it go, Mrs. Smith? Do you feel any pain? No? Good. Then I will clean up now. All right. 20 seconds of hand hygiene. You can turn it back now, Mrs. Smith. I will remove your mask. And here. And then I will cover you up, of course. And then clean my hands again. All right, I am finished. Do you have any questions for me? No? Okay. Thank you for letting me change your dressing and working with me throughout the process. I will check up on you later and make sure everything is okay. I will put the bed on the lowest position. I will raise up the side rails, and I am going to throw this into the garbage. I'm going to throw this into the garbage. I'll document that the site was clean and dry and there's no sign of infection. The marking is the same as last time, which is 20 centimeters. The tubing is not cracked or leaking. The patient tolerated the procedure well. Thank you.